Were you insinuating that I was repeating myself earlier?
You repeat yourself all the time.
I think that it's fair to say that at some points I have in fact repeated myself. I'm not sure it's all the time. As he purses his lips together in distrust.
Over 7 years, a wonderful, lovely 7 years together.
Be careful.
There are certain stories that have reached double-digit proportions.
It's probably an excellent story.
I'm wondering when we're going to hit the triple digits. But I have the patience of a saint, and I love you, and you're quite lovely.
Let me put it this way. If you want the 7 years to go forward into 7 more years, I'd refrain from mentioning it yet again.
Balls Deep.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pazona, a board-certified urologist and CEO of Pazona MD. We hope you enjoy. Now, let's jump right in. Stream team, welcome back. We are here in follow-up of our last week's episode of a cliffhanger of
Talking about what do medical practices do to get away from the nightmare that is the awful situation of health insurance companies in this country. What do you do? You said there was a different alternative.
There is, and one that's actually been around for several years, and we're starting to see more traction, especially in the primary care space.
Okay.
But we're also starting to see it in the specialty space, and I'm proud to announce that Pazona MD will be moving to this model come 2025. So
so this is happening.
It is
It's
happening.
on.
This is the announcement to the world. We have let the team and patients know, but this is happening.
Okay, you're letting the proverbial cat out of the bag.
That I am.
All right,
That
hit
I'm-
it. What is
All right,
this?
ready? Let's go deep into it.
Let's do it.
Balls Deep.
So it is called direct specialty care.
What does that mean?
Very simple. You receive care directly from your doctor without middlemen, without gatekeepers, without insurance companies telling you what you can or cannot do. What is a, quote, coverable or non-coverable service? Simply, the doctor, provider does what is best for you, and then, novel concept, you pay the medical practice directly for the care you receive. This is every other industry that we're in. You come to an agreement. You can look at it from patient, physician, from business to customer, attorney, client, trainer, client, whatever sort of relationship, you enter into an agreement. You are going to do the following things for me, and in return, I'm going to behave in a certain way and pay you this amount for your services.
That seems so simple.
Isn't it wonderful?
Well, it seems a lot easier, frankly, but I have a lot of questions about this.
Absolutely.
So should I go?
Yeah, let's go for it.
Okay. So direct care, direct pay is the model.
Mm-hmm.
So what if I have, as we all, pretty much all of us, have health insurance that we're paying for? What happens to my health insurance? I can't use my health insurance to pay you now. Is that correct?
So, correct. So, as a direct care practice, we are no longer going to submit claims to your insurance company. Instead, you are going to pay us directly for medical services. And if your insurance company allows, we will provide you with what's called a super bill, or just an outline of the services we gave. And you yourself can, in some instances, go to your insurance company and try and get reimbursed. Now, there's a couple caveats. If you have Medicare or Medicaid, the federal or big state programs, they never allow this. So don't even bother trying, just not going to happen. If you have a commercial insurance plan that requires you to see an in-network doctor, remember that from our last discussion, this idea of in-network, out-of-network. You know, right now you could have a commercial insurance plan and go and see a doctor who's also in insurance plans. But if they're not in network with your specific one, you have to pay that doctor to be seen. Now, in some cases, an insurance plan may or may not have what's called out-of-network benefits. So if you have a commercial plan and out-of-network benefits, then you could submit it. And my recommendation to everybody is you should still have some degree of insurance for big ticket catastrophic items. I mean, any one of us could get in a car accident. Any one of us could have a horrible cancer diagnosis and require tens of thousands of dollars of treatment to get through the process.
Isn't that falling under something people would call a catastrophic, like you've just said, a catastrophic insurance coverage?
Absolutely. And we will also later discuss what we're doing as an alternative model in what's called health sharing plans or health savings plans.
But before we get to all of that, see, all of that you talked about, I just asked you, could you use the insurance to pay for a direct care visit? It all got really sticky again. It all got really complicated and confusing, and all the things you just said, I kind of spaced out. I do.
All right, let me back up and clarify.
But isn't that the point, that it's still sticky?
Well, it's sticky if you start asking, what about my insurance?
Right.
If you just forget about insurance, then you just pay us for the services, and it's that simple.
That seems easy and simple.
Yes, it is. But there are going to be some patients who are going to ask, can my insurance still cover this? And the short, clearer answer is
maybe,
and we're not doing it.
That's on you.
Correct.
To then take the super bill that you can get from your direct care physician, and then you get the lovely task of taking that, and now you have to manage working with the insurance company, which I'm sure will be fun.
Well, and that's not to, I want to be careful here. Some people listening will be like, well, thanks, Doc. Why aren't you doing it for us? Well, I just explained, for us to do that at scale for the hundreds of patients we're trying to care for, I have to hire so many team members, I can't pay my bills.
And take so much of your time away from being a physician.
Let's do what we're great at. You're coming to see me for medical advice and medical care. Let me and my team focus on that and push everything else to the side. And if you decide for your time you want to try and get reimbursement for that money, that's up to you. Just like you can go and, if you get in a car accident, you can decide to either just pay the shop $500 or go try and fight your insurance company for the money. You can get a rebate for something and fill out all these applications and send it in for different things.
Right.
That's for you to decide, but you don't want your doctors doing paperwork. We want our doctors delivering health care, and that's the only way we're going to get healthier or better care.
So my next question, I completely agree with all of that, but my next question is, but to play devil's advocate, but I already have health insurance and I'm paying a lot for my health insurance. So now I'm going to also have to pay cash to see my doctor. Does this work out for me?
That's a great question and concern. And so there's two aspects to consider. So the first one is a bucket of people, a large percentage of people, especially if you're not at Medicare age yet, where most things are covered. You already have a high deductible out-of-pocket expense in a large majority of cases. When a patient, say, comes to see me for a vasectomy, over 2/3 of those men who have insurance still have to pay the full price.
Oh.
Why?
2/3.
Because they have a high deductible plan. They have insurance, but insurance isn't going to kick in until they put in themselves X thousands of dollars. For us personally, I've calculated, we have but are getting rid of a Blue Cross Blue Shield plan. I currently pay over $2,000, actually up to $2,300 a month. And even then, unless I put in an additional $18,000, they will pay for zero.
And this occurred. I will throw this in. My foot surgery. Did everybody remember my beautiful boot and my weird foot shoe? So my foot surgery it was paid for in cash. All of our fancy insurance covered exactly no dollars of my rather expensive foot surgery.
So
I already am paying cash on top of paying for my insurance.
you start doing the math and you're already paying thousands upon thousands of dollars. The difference is, rather than pay it directly to your doctor, you're paying it to an entity who's raising their shareholders' price. Now, there are going to absolutely be people who are hearing this and goes, now, wait a minute. I actually have a really good insurance plan, or I'm covered by Medicare or Medicaid. And truly, most of my bills are covered. And my out-of-pocket expense is next to nothing, and my premium's reasonable. Why would I consider this? Well, certainly, again, this is not for everybody. But what I would argue is the service and the value that a direct care practice can deliver compared to the alternative is night and day. Let's just go through a couple of those things. How many of you have tried calling your doctor's office to only get a voicemail that never gets returned?
Oh, that's happened to me multiple times.
So it's not just one phone call, it's multiple. So let's think about all the time you spend reaching out to your doctor's office and hearing nothing. Now you have to take time out of your day, you drive to the appointment, you get there early, then it's the loads of paperwork.
All the forms to fill out.
Why do those
in triplicate?
Why do those exist? Insurance. Next, you are seated in a crowded waiting room, sometimes for 45 minutes, an hour. I've heard of people going to competitors down the street and spending several hours in a waiting room.
Good grief.
How many of you would make a restaurant reservation
And wait for hours?
Wait more than 15, 20 minutes before you saying, I'm done, honey, let's go home and get some pizza.
Absolutely.
And then leave a 1-star review and never go back. But yet, I know patients who have gone to doctor's offices and wait every single time several hours. But wait a minute, you finally get time with your doctor.
And they spend a long time with you, right?
Right.
They sit, they answer all of your questions. They wait until you feel comfortable to end the talk. That's how it goes, right?
They spend
Not
less
so
than
much.
less than 10 minutes with you, and the entire time they are looking at a computer, clicking buttons. Why are they clicking buttons? Insurance companies. And why are they only spending 10 minutes with you? Again, they're not going to pay their bills unless they see 40, 50 patients that day. So you're waiting a couple hours because they had to triple book their appointments because a third of the patients won't show up. We got to squeeze everybody in. And so all of that, then you get prescribed a medication and you have a question or sent to the wrong pharmacy and you can't get a hold of someone.
And you can't ask the question.
Even if they solved your problem and you're excited to get this medicine, where is it? Went to the wrong pharmacy, wasn't sent, forgot. I have a lab test order. What I want to know the results. Well, we can't get you back in for 6 to 8 weeks.
It is infuriating.
So
and it's frustrating.
If that sounds like an appealing system for you, and you're willing to say, I don't want to put any more money in for a better experience, or if you're lucky enough to be at a doctor's office where it's not quite that bad, then best of luck, in all seriousness. And I don't mean that in any snarky way. Like, go for it if that's what you want to do. If, on the other hand, you are fed up and would like an alternative model where, I don't know, we answer our phones.
A human person answers the phone.
Your bill is already paid and there's no surprise deductibles or copays. Like you walk in and we don't collect $1 because it's already been paid. Your 1-page form is simply us getting to know you and making sure you're aware of all the different ways we can help you. You're brought back in less than 5 minutes for a visit with your provider, which can be as long as you need. And if you're waiting, we get you a cup of coffee, buy you lunch.
Sounds pretty appealing.
When you leave our office, you have the phone number or the email, the portal access to message us anytime. Oh, you want a phone call back from us? Sure, we'll call you back. And, oh, you want a follow-up visit in 2 weeks? Perfect. We'll get you in. We can do all that. That is deliverable if you remove all of the complexity of insurance companies. So if that sounds like a more valuable and a better patient experience, one where you actually form a relationship with your provider and improve your healthcare, then that's what direct care can give you. And the direct primary care model has been showing this for years. So for any of you out there, primary care is it is the foundation of our healthcare system. This is your general practitioner, your internist, your family practice doc, whatever you want to call them. I go to them first for everything, right? And because they don't do procedures, because they are not a hands-on people, but yet they are doing really the most important work in healthcare, in order to cover the 10 things you've got, your diabetes, your back pain, your heart disease, getting you to stop smoking, getting you to eat right, and again, we're in a volume-based game, they can't spend any time with you. So there has been a huge proportion of these docs who've said, forget this, and they're doing direct primary care. They'll do house calls. You can call them and see them the same day.
Wow.
They can get you cash prices on prescriptions that are a fraction of what you'll pay CVS and Walgreens. These are all the things we can do as physicians when we say no to the complexity of insurance.
So what you're saying is if you say no to insurance, there are ways for me as the patient to pay lower rates for prescription medications, reasonable economic rates to see and talk to a physician for as long as I need to. These things are possible.
100%.
Is that true?
100%.
It seems like a dream.
It's not. A powerful business concept I've learned is when you say yes to everything, you're saying no to certain things. And in healthcare, we say yes to insurance reflexively. Patients, doctors, we need insurance, right? And what do we end up doing? We end up saying no to simple, transparent pricing. We say no to access to your provider. We say no to spending time with someone. We have to, because it takes so much time and effort and money to deal with insurance companies just to make sure we can keep our lights on, that none of that is possible. So I'm so excited that we're finally going to be putting our time and effort into things that I was trained to do, to take great care of people. I didn't train to figure out whether I'm enrolled with which Blue Cross S plan, C plan, D plan, FU plan.
It seems like a waste of time for everyone involved.
I didn't go to school for 13 years after high school to fight for $112.42 for the 45 minutes I spent with you in the office and the 2 hours my team spent behind the scenes to make sure you got all your x-rays and your follow-ups and your records from your other doctors sent over.
It's exhausting.
It is. And it doesn't...
And it doesn't get good health care.
It doesn't get good health care. It doesn't appropriately value what we can do as physicians. It distracts us. It's just... Healthcare should be simple. It's complex enough. It is hard enough to figure out what is the best treatment for cancer or heart disease. We shouldn't throw into it, how do I just make the operations go?
So direct care, direct pay is a model for specialists and not just primary care doctors.
And we're seeing this more and more. We have I have a colleague out in California, a rheumatologist on call, Dr. Garnita, phenomenal physician. She spends an hour with her patients. Now, you have to pay her appropriately for her time, but good luck getting a rheumatologist who's going to spend an hour with you and give you that depth of care. There's a large cardiology group in this country that is doing cardiology care at scale for direct payment. There's an orthopedic surgeon based out of Colorado who I love his model. He doesn't even have an office space. He'll go to the primary care doctor's office and it's just him. He'll do his house calls and do his surgeries and anything else that you need without even running an office. And they're able to do that when you say no to that complexity.
Seems like, to bring this down to the most basic, it seems like when you eliminate the insurance complexities and the problems that the obstacles, maybe is a better word, the obstacles that insurance brings into the patient-physician relationship, you can get back to what was originally intended. Your doctor sitting and spending time talking and listening with you, the patient, to give you the best health care possible.
100%.
Did I get it?
You did.
Okay.
One other thing worth covering, because I alluded to it earlier with surgery. So some patients are also going to ask, well, can I use my insurance to cover for surgical procedures,
That's a good question.
for x-rays, for medications? And the answer is yes. You can still use your insurance to pay for those things. Now, prior authorizations, getting things scheduled, those things do take some time. And very often, again, if you've got a high deductible plan, and we've seen this personally, and I've seen it with our patients, if you run it through insurance, you may get a bill that is 10 times what it would be if you just paid cash.
Really?
We order...
How is that possible?
Well, because these companies, these vendors, right, in the medical space are playing the same exact game and fighting the same exact things with insurance companies. So they don't know how much they're going to get from one insurance company. They've got a bunch of times they do lab draws for free. So, well, guess what? If you got Blue Cross Blue Shield, we're going to charge you $572.34 for $25 worth of labs. I've had patients come to my office showing me their bill from these places. And then we go, well, that's ridiculous. And I call our local vendor, hey, switch this to a cash price. We collect a nominal markup. And now all of a sudden that $500 bill is now under $50 and goes away.
$500
Oh, yeah.
to under $50.
It is absurd. And so
wow.
You still can use it. Now, surgery is a special one because this is, again, I'm trying to keep it as simple as possible, but it does get confusing. When you have a surgery, and you just saw this.
I did.
There's really 3 different entities that are involved. The surgeon, the hospital or surgery center.
The facility.
And then the anesthesia team. Now, sometimes the anesthesia fee is bundled in with the facility fee.
But in my case, in the foot surgery, it was not.
So there's three, you got 3 different bills.
Actually, I got more because I thought I had paid the physician fee. Apparently, they came back with a second physician fee, a facility fee, and then the anesthesia fee. Mm-hmm. And I'm kind of still sitting at home. The surgery was 2.5 months ago. I've paid all of those, again, that were completely cash. I paid cash for all of this. And I still am at home waiting to see what else may show up in the mail that I have no idea that it's coming, no idea what the cost is, but I'll be on the hook for it.
Yep.
So, not the most fun. It's not the most fun, I'll be honest.
It's not. And so in this model, you will pay directly to our practice our surgical fee for my time and expertise to do your surgery and take care of you. You may still use your insurance to cover the other fees is the short answer.
The facility fee, the anesthesia fee.
You can still use your insurance
labs,
for that. Yep.
Medications, x-rays, those things.
But understand, because of deductibles, because of this price gouging, you may end up paying more than if you simply said, what's your all-in cash price?
Right.
So
I am sitting here wondering very much what the foot surgery would have cost if we had just asked for a cash price.
Yeah, probably was a fraction.
Because it was very expensive with insurance not paying for it.
Yep. Well, why don't we maybe end, Kat, on covering sort of what options are out there for patients, help defray some of these medical costs? Because
that's good, because you and I are making a change.
Yeah. So what we're doing is we're dropping our Blue Cross Blue Shield plan.
We are dropping it.
We are done with it.
We're done.
We are moving to what's called a health sharing plan. So what is this? It's what insurance companies were supposed to be in the first place. Let's all get together. Let's pool our money. And then everyone puts in a certain amount each month. Let's put a reasonable, quote, deductible or out-of-pocket max. And then if, God forbid, something happens to you, the whole group will cover it. And these plans have been around for decades, believe it or not. They started in churches, but then have moved to non-denominational or more secular organizations. Sedera, Zion are a couple to look up. And when we did the cost analysis,
it was hugely different.
It was a huge difference.
I mean, it was Grand Canyon of a difference.
And it covers everything, because then what they're going to do is they're going to negotiate cash prices on your behalf that are often better. And then they provide access to various platforms where you can go get that $500 mammogram through insurance for $75.
Oh, it wasn't $500. the mammogram. No, thousands.
Yeah, it's absurd.
Yeah.
So that's out there. There are, people have flexible spending accounts and health savings accounts through their employers. You can utilize that for direct care. And then the other exciting thing we're able to do is use sort of some best-in-class financial options. So most traditional medical credit stuff ends up being very predatory rates, really, really, difficult credit checks,
Not
things like
helpful.
that. So what we're going to be using goes through Affirm, which does a soft credit check so it doesn't hurt your credit score, instantaneously approves the majority of people, and offers much, much more reasonable single-digit financing rates so you can finance this over time. We understand that sometimes medical things can cost some money and an investment, but it's just so interesting in our country. We won't bat an eye at our $1,000 new iPhone, our $200 to $300 a month cell phone bill. Oh, we want that nice new car. That's $500-600 a month. Oh, I want to join that fancy gym. I've got these, death by 1,000 cuts by all these streaming services. Next thing you know,
Our
you're spending
manicures, our hair appointments.
all of it, right? But yet you say, I got to pay $100 a month for healthcare. Oh my God.
And we don't want to do that.
So we've got to start changing that because people don't understand or just aren't honest with themselves. Your insurance is not providing healthcare. It is not defraying all of your medical expenses. So that's what I want people here to leave with.
Sounds great.
Yeah.
I think direct care, direct pay sounds pretty good. And I'm all in for a doctor sitting and talking with me and actually answering my questions for once.
Yeah. We already do that, but now we're going to be able to keep the doors open and do it even better. So I'm excited too.
Yes, it won't matter if you can't open the business. So
Yes.
sounds great.
Well, Kat, do you want to finish with your favorite segment here?
Oh, I was not prepared for that.
Well, let's do it anyway.
Okay.
Just the tip.
So what'd you learn today? What are the top three
now I'm
things
really
you learned?
put on the spot because I have notes, but none of this is a wrap up.
Very high production, lots of preparation go into these
None at all.
podcasts.
So number one, I learned that the complexity of insurance keeps us as patients from having the best access to our doctor, to their time and to their information.
Great.
And number two, if we take out the complexity of insurance, we can get that time back. And number three, all of the money that we think we are paying into insurance that is keeping us healthy, that is paying our doctor, is not doing that to most of the extent. And a direct care, direct pay model, though it seems that it's costing us a little cash, is actually a much cheaper and more effective way to getting the health care we need and deserve.
The keyword's effective.
Okay, effective. Okay.
I think we can all agree that with 100% certainty that our current healthcare system
Stinks.
and the only people who are benefiting from it are the shareholders of United Healthcare and all the greedy fat little fingers coming in and profiteering off of our sickness. We are an unhealthy society, people. This system doesn't work. And one of the reasons is because we're all beholden to this insurance model that simply doesn't value your health. So I'm excited ultimately to opt out of insurance and opt into you.
Oh, I like that.
So
I like that.
with that, Stream Team, thanks for sticking around for this episode. We hope that you found this valuable. We're making this change with a heavy heart. We understand that certain patients may not be able to see us, and for that, I am truly sorry. But I also am excited that we're now going to be able to more deeply serve people, and we're going to be able to keep the lights on and create an alternative system that truly creates health care instead of managing sickness. So with that, please show yourself a little bit more love and kindness. We're all works in progress, and these are opportunities to grow. Thanks and have a great day.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pazona MD, please visit pazonamd.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.